If the healthcare system in the United States costs more than any other country in the world and is this profitable, why would the companies inside this system ever want it to change? And if America moved toward a universal healthcare system tomorrow, where would the biggest pushback actually come from? Today we're talking about private insurance, profit, power, and why changing the healthcare system is much harder than just passing a single law. Welcome back to my channel, Not in Kansas Anymore, where we talk policy over politics. Over the last few videos, we've talked about the American healthcare system, what a national healthcare plan could look like, and whether universal could actually reduce overall costs for Americans. But today I want to focus on something different, because one of the biggest questions people ask anytime healthcare reform comes up is this: if universal healthcare could lower costs, why hasn't it been done yet? And a big part of that answer comes down to private insurance companies, the industrial connection to them, and the massive system that has developed around healthcare in the United States. Now, I also want to make something else clear before we go any further. This video is not about blaming insurance companies or pretending everyone working inside the healthcare industry is acting in bad faith. Large systems naturally develop around financial incentives, existing regulations, and the structures they operate inside of. And when a system becomes deeply tied into the economy, major reform almost always creates resistance, whether that's healthcare, energy, banking, or any other system inside the government. So this video is less about assigning blame and more about understanding why changing a system this large becomes politically and economically difficult. When most people think about health insurance, they think about coverage. You pay into a plan, and when you get sick, the insurance company helps pay the bill. But private insurance companies do much more than just collect premiums. They negotiate with hospitals, they create provider networks, they provide or deny treatments, they approve or deny medication, they determine what is covered and what isn't, they manage billing systems, and in many ways they act as the primary intermediaries between patients, providers, and payment systems. Now, to be fair, insurance companies argue that these systems help control costs and prevent unnecessary spending. And sometimes they absolutely do, don't get me wrong. The downside to it is this: it also creates a system where medical decisions can become tied to a financial calculation and not a necessity. And that's where many Americans become frustrated, because people often feel like they're not just dealing with the doctors anymore, they're dealing with an entire approval process layered on top of the healthcare that is profit incentive driven. One thing that surprises a lot of people is that insurance company profits actually increased after the Affordable Health Care Act was passed. Now, that might sound strange at first, because the ACA was designed to expand coverage and regulate parts of the insurance market. But at the same time, it also expanded the number of people participating in healthcare insurance system. More people enrolled, more plans were purchased, more private insurance companies remained at the center of the system. And this highlights something important. Expanding healthcare access and reducing the role of private insurance are not the same thing. In many ways, the ACA expanded access while still preventing the large insurance infrastructure to continue. And today, private insurance remains deeply tied into almost every part of the American healthcare system. Employer-sponsored health insurance, marketplace plans, Medicare coverage, prescription coverage, billing administrations. All of these systems create an enormous healthcare economy built around private insurance. And before we continue, if you've been enjoying the healthcare series, make sure to like, subscribe, and share the video. And always, I appreciate hearing different viewpoints in the comments, especially on topics this complicated. If you want to read the full healthcare policy proposal for yourself, there is a PDF linked down in the description below. Now, this brings us to the real question. If America tried moving toward a universal healthcare system, like the national healthcare plan I've talked about in the previous videos, where would the biggest resistance come from? First and most obvious answer is private insurance companies themselves. Because under a universal public system, their role would become much smaller. In this proposal, private insurance would still exist, but it would mainly cover supplemental services, elective procedures, and areas outside the core national plan. That means insurance companies would no longer sit at the center of basic health care coverage. And for an industry worth hundreds of billions of dollars, that's a massive shift. But the pushback wouldn't stop there. There are entire industries connected to the complexities of the current system. Billing companies, administrative contractors, consulting firms, large healthcare management organizations. Even many employers have built compensation packages and systems around providing healthcare benefits. And when systems become this large, they develop momentum, millions of jobs, massive financial interests, political lobbying, advertising, campaign donations. And at that point, reform stops being just a healthcare debate. It becomes an economical and political power struggle. And this is something I think often gets missed or ignored in healthcare decisions. People sometimes talk about reform like it's simply a matter of voting yes or no. But changing healthcare means restructuring one of the largest industries in the United States economy. And even if a new system could reduce total costs overall, there are still groups that would lose money, lose influence, and lose market share. That doesn't automatically make them evil. It just means the incentives inside the system are designed to protect the system. And honestly, that's true in almost every major industry. The bigger something becomes, the harder it is to change, especially when millions of people depend on it for their jobs, investment funds, retirement accounts, and business revenue. That's why healthcare reform becomes so political and so difficult. Not simple because Americans disagree on healthcare. Not because entire economic structures have formed around the current model, but because billions of dollars and different industries are all tied to this complex system. Now, even under this healthcare proposal, private insurance would not completely disappear. There would still be a market for supplemental coverage, elective procedures, luxury care options, expanded to private rooms, specialized non-covered treatments. And that's important because most universal healthcare systems around the world still maintain some form of private insurance market. The difference is the role private insurance would play. In America today, private insurance often determines whether basic health care is even affordable. Under this proposal, the goal would be for private insurance to become supplemental rather than foundational. And here are my final and closing thoughts on this. At the end of the day, the health care debate is not just about health care and medicine. It's about money. It's about incentives. It's about political power. And it's about deciding what role private companies or the government should play inside a system people rely on just to survive. And whether people support universal health care or oppose it. I think understanding those incentives matter, because systems don't just continue by accident. They continue because powerful institutions, industries, and financial structures are built around them. And that is why healthcare reform in America has always been about much more than just the healthcare alone, or even the people it would help. Thank you for watching, and I'll see you in my next video where I will give you my wrap-up and final thoughts on the healthcare reform in the United States. Again, this is not in Kansas anymore, and we'll see you in a week.